Hello everyone, welcome back to my channel. My name is Marlo Keenan and today is going to be a different type of video. Today I want to talk about my story regarding some health issues that I have been dealing with for the past few months. This is a story regarding hearing loss. It's a story of potential Lyme disease, and I'll explain a little bit more about that later, why I say potential. And I also want to talk about the treatment of Lyme disease. I'm going to be honest with you guys, I really don't know if I'm even going to post this to YouTube. I really want to, because I really want others to learn from my experience, kind of figure out what to look for in these instances when things like what's happened to me happens to you. I know I sound like really jumbled up. I'm really nervous about this video just because I'm so vulnerable and I'm a very private person. But if I do decide to post this, I just want somebody else to learn from my experience, and it's also going to help you to see the process and to see the administration of the treatment of what I've been dealing with. If I don't post this, I mean, if anything, I'm just happy that I'm recording it. For at least, if anything, for my family and friends, just to see and to help them understand how I'm dealing with this and what it's like to have this horrible thing happen to you. And to me, it's absolutely devastating and horrible. So if you like to know and hear my story regarding this, please stay tuned. So how I want to begin my story is really start from the beginning. I'm going to give you guys super details, dates on exactly what happened to me. So let's just start off. In June 8th, it was a Thursday, I was on the phone with a colleague, and all of a sudden I heard this like ring in my ear. It was just like a really sharp buzz, like I didn't even say that right, but buzz, and it made me jump. And the person I was on the phone with, I was like, did you hear that? And he was like, no, Marlo, what are you talking about? So I brushed it off. I went through the weekend and it was intermittent, very just me hearing ring off and on. So again, I didn't think nothing of it. And then on Monday when I woke up, the ringing was consistent. It just was just buzzing away. It didn't stop. And this is in my left ear, by the way. So I was really worried. I mean, I wasn't feeling well. I was feeling like really lightheaded, not dizzy, because dizziness is when like the room is spinning. It wasn't that type of feeling. It was like when you get up really fast and you're just lightheaded, or you smoked a cigarette for the first time in your life, how you feel lightheaded. So I immediately went to the doctor's. She was like, okay, you might have a little vertigo, tinnitus or whatever, and what that is the ringing of the ear. So she prescribed some Valium for me to subside that ringing, because she said that the Valium will relax those nerves that are making it ring. Now when she did my examination, everything was good, it was clean, everything was beautiful. She said outside of a little capillaries being inflamed in my left ear. So I went home. Oh, actually, also what happened was she told me I had high blood pressure too. So she also prescribed high blood pressure medication, which I started taking that Monday. So that night, all of a sudden, when I was going to bed, I noticed that I had like complete hearing loss. Like I felt like I could not hear, but I went to sleep. The next morning, it was a wrap. Okay, like I woke up, I was like not bouncing off the walls, but I was so lightheaded, I could barely stand, I could barely walk. The ringing was still there. I mean, it was awful. So I called some friends, this, that, and the other. I ended up going to the ER. Actually, I did work that day, but I went to the ER. I just worked for a few hours because it was just unbearable. So I get to the ER, do all these tests. They don't know what's going on. I ended up getting an MRI because they wanted to make sure that everything was fine, because when you're dealing with the ear, they're going to make you get an MRI just to make sure there's no tumor, this, that, and the other. But they didn't know what was wrong with me at the end of the day. So they told me I needed to go see a specialist. So I got Kaiser. So I had to go through that mess. and I got in actually the very next day to the specialist. So I get to the specialist, I'm like feeling like it was just awful. Like, just let me tell you, when I left that ER, I literally had to have about 6 days of 24-hour care. I mean, I'm so blessed with blessed friends and families, they literally put in shifts. You know what I'm saying? Somebody stood at night, somebody stood during the day, somebody stood a couple hours this day. That process was like that for me for 6 days post that ER visit, because I was dizzy, I couldn't, walk and stand straight and all that jazz. So going back, I went to the specialist the next day. They checked my ears. I actually had hearing loss on my left ear. Right ear is fine. She told me that I could probably hear sounds like airplanes, lawnmowers, but I had no clarity. And in the ENT world, clarity meaning speech. So if you were to talk in my ear, all I hear is static. Okay, so that was the confirmation of that. So that day, the specialist prescribed prednisone, which is a high dosage of steroids. I had to be on 60 milligrams for a week and then be tapered off by with 20 for an additional 5 days, because you just can't, you have to wean yourself off that. And that's what they do. They don't know why I have the hearing loss. They don't know what's going on. There was no signs or symptoms to make me have this hearing loss. It was sudden. It's called sudden sensory neural hearing loss. That's what it's called. That's how they treat it. So I did that. I did the prednisone thing for those days. I had a follow-up appointment on the 21st, and that appointment was regarding if the prednisone didn't work, then the next step was to literally get injections of steroids directly into my ear, because studies have shown that if you do that at least 2 to 3 times, there is a chance of recovery of that hearing loss. And mind you, I only have 30 days. Usually, they say if nothing's happening within that 30 days, most likely hearing loss will be permanent, or is just a very low risk for it to come back. So on the 21st of June, which is just a week later from me being in the ER, I started getting those injections. I mean, guys, the emotions I was going through at the time was horrible. So much anxiety, so much sadness, like just depression. Like it was so unbearable to wake up one day and not be able to hear and then have to undergo all of these things. It was, for me, just horrible. So I went in that day. I got the injection in my ear, which is not fun. It's very uncomfortable. I'm not going to say that I was like in total pain, but to have Novocaine in your ear and then get a steroid injected, it was just like traumatizing to me. Okay. So we started doing that. Now, mind you, up until this time, there's no improvement. So I go through that weekend, and then Tuesday, I wake up and I hear ringing in my right ear. I mean, it was like 5 o'clock in the morning. I was hysterical. I was crying because just the fear of it happening again in the right ear and me being totally deaf. I mean, you don't understand the things that go through your mind. And I was just scared. I was 6 o'clock in the morning. I was just hysterical. So I called my specialist and told her. All she said was like, well, we just want to make sure we keep an eye on it. Is it gone? And it was gone. It did go away. But right away, just because of what's happened to me in my left ear, she wanted me to go see a specialist above her. Like, I got, like, right now, guys, I got 3 specialists in a primary care position, okay? Like, seriously. She referred me to a person that's been doing this for over 25 years. And let me tell you guys, he is amazing. And he specializes just in the ear, where my specialist was like an ENT ear, throat, nose doctor, where he is all ear. And he's been doing it for 25 years. So she got me in to see him right away. And he did mad tests. Like, I got the hearing test again. I got balance tested. I mean, just the whole works. And he gave me some information. Basically, the results were the same in terms of me in terms of the clarity that I currently had in the left ear, the sound. But he did reassure me. He felt that. He said, Marlo, he said, I really don't think that you're going to go deaf in the right ear. Not to say that it's not possible, but he didn't feel that. So I did take comfort in that. And he talked to me about things that I could possibly do if even the worst case scenario happened. So he was very reassuring, but at the same time, when I left that office, I just still felt just really sad because nobody knows what the hell is going on with me at all. Okay, now I want to back up the story just a bit. When I got that last ear injection, which was just a week before, you know, I'm talking about it with my best friend and stuff, and we're just brainstorming some things. Now I'm so emotional at this time, guys. I am in healthcare, but it's not like I'm a nurse, but I'm well informed. I am a research person. You know, I do know some things. And so ultimately I had told my specialist to test me for Meniere's disease, Lyme disease, all of these things, you know what I'm saying? She was like, well, we don't know if you're, you know, if that's possible. You know, she just was like, that's far-fetched. But I am from up north, even though I've lived in Georgia for over 15 years. So that Monday, before I woke up with that ring in the ear, she had just called me telling me that I had tested, out of 8 of my 10 markers, I tested reactive to Lyme disease. Now, she's also telling me that, and everybody's telling me, that you could test for Lyme, you could test positive for Lyme disease and don't have it, and then test negative and have it. So I'm like, what's this? So in that meantime, she's setting me up with the infectious disease control folks, okay, so I could get tested by them as well. So this story, every week, guys, I was going through something. Every week I was getting blood drawn. Every week there's something happening where I have to go see some specialist. It was just very, very nerve-wracking. So after I went to that specialist above her that confirmed my hearing loss and gave me some options, I went home, and basically it's a waiting game to see. I needed to finish that prednisone. So as you know, I'm finishing up my medication, I go in for my second ear injection. Okay, so I go in there for that because there's still no changes to my hearing loss. Now, mind you, when I was speaking with my other specialist, the one that only specializes in the ear, at that time he told me of a procedure that was done, that he has done on somebody, that it worked. And it does work sometimes, and sometimes it doesn't work. And that was a surgical procedure in which they take a gel form, like whatever substance or whatever, and they fill it with, you know, steroids as medicine, and he actually places it at the canal or past the cloaca, or before the cloaca actually, and the medication is like directly seeps into those nerves. Like, it's like the most direct application of getting the meds in there. But he told me, he was like, Marlo, you know, it's a 20% chance it may or may not work, you know. And it was funny because I actually had to really comfort him because I wanted the procedure. Now, mind you, now we're at the end of the week of June, and I have to go we're going into July. Again, I have 30 days to do a procedure like that based on the first day that I lost my hearing. So here we're at the last week, and now I called him that week, and I had to get it done by, basically, because I was so undecisive, I didn't know what I was going to do. And they was like, well, Marlo, you got to come in right away. We got to get the surgery done. You guys have no idea what I went through just to get the surgery. I had to go back to the doctors, to my primary. I had to get a chest x-ray just to get clearance. I had to get pre-certed from insurance. I mean, it was just awful. But I feel that if I didn't have that surgery, I would have been wondering if it worked. You know what I'm saying? Even if it was a 20% chance, I had to go for it. So I got that surgery actually on July 7th. I got the ear surgery, and I hope I don't seem like I'm jumping around the story, guys, but I just trying to explain the process. Now, mind you, all that was happening. I got that scheduled for the 7th, but that day before, I had that appointment with the infectious disease doctor specialist. Okay, now mind you, all these doctors and specialists still don't know what's going on with my hearing loss, and the Lyme disease, whether or not I have it or not, is not necessarily saying that that's related, because people that experience hearing loss with Lyme disease is a very small percentage. Okay, so you just don't know. But before I had that ear surgery, I had that appointment with that physician the day before. And so I go in there, he's telling me the same thing, you know, you may have it, you may not, but they want to treat me for it. I'm like, okay, you know, but then he's going to say, well, you should, I want to put in an order for a lumbar puncture. And I was like, oh, hell no. I feel like this. I'm like, why the hell am I going to do a lumbar puncture if you're going to treat me for it anyway? If you're going to treat me for the Lyme disease, why am I going to do that? So I just totally felt uncomfortable with that. I decided not to do that. Okay, so then he explains, somebody knocking at my door, seriously? So then he explains the treatment for Lyme disease. Basically, in a nutshell, because my symptoms, well, actually, I don't have any symptoms. Lyme disease is something that people, it's derived from a tick. It's transmitted by a tick. You'll get a rash and all of that jazz. Now, I have no symptoms at the time of Lyme disease. I have no dizziness, no flu-like symptoms. I don't get the migraine, joint pain, neurological symptoms, which could cause paralysis to one half of your face. I mean, vomiting, nausea, none of that stuff. However, 2 years ago, I did have ringworm on my arm, which could have been Lyme disease, but they don't know. I mean, they just don't know. So in any event, the way to really truly know if I have it or not is through the lumbar puncture, but I'm not doing it. However, I did show the markers for it. So, and they tested me twice. Lyme disease, how they test for the bacteria Borrelia. I'm not sure if I'm pronouncing that right, and there's 4 different types. So that's, you know, the bacteria that signifies that you have Lyme disease. So I had agreed that I would probably do the treatment for Lyme disease. However, I was so distraught. I had so much anxiety. I mean, I was going into surgery the next day for my ear. I'm like, look, he wanted me to start it like right away. I'm like, I need a break. I mean, I need 2 weeks of not seeing a doctor, not seeing anybody. Like for the whole month since June 12th, I've been in the ER seeing doctors. I needed a break. It was just too much. Just give me a break. And I just said that I will call and schedule it when I'm ready. Once the week, you know, the weekend went by, I thought about it and I was more at ease. I decided to go ahead and get that treatment for the Lyme disease. And that treatment consists of getting a Picc Line. And I don't know if you guys understand what a Picc Line is, but it's basically a catheter that's going through your vein that's inserted through the arm that it goes almost right to the heart. So that, I mean, just finding that out, it was just like, I can't take this. I'm just like, I just like, God, take me out of my misery, right? So anyway, that's the chain of events regarding the Lyme disease. Okay, but then I had the surgery for the ear, and then I had the follow-up a week later. Okay, no change in my hearing whatsoever. There's just no change. There was no change, and I'm continuing to see the physician. So guys, this has just been just a whirlwind. So once I decided to actually schedule the Picc Line, I did so. Now the treatment is to get the Picc Line, and the medication is Rocephin. I have to take Rocephin for 28 days. Picc Line has to be in my arm for 28 days. I currently have it right now. I do get it taken out next week, which I'm just so happy about. And I'm going to explain a little bit more about that as I demonstrate the administration of what I do. And that part is going to be difficult to me. I'm nervous about even doing that on, you know, on camera, but I really want you guys to learn. And there may be some people out there that have a Picc Line that are doing the same type of medication that I am, that want to see actually the process of how to do it. And I think it'll just help somebody. So I'm gonna go ahead and start and show you the setup, and we'll move forward. Okay, so this is the actual setup. This is my medication. This is the Rocephin. These are 2 of the heparin, and this is just 3 syringes of saline. And of course I have my alcohol wipes, a pair of gloves, and 2 green caps for line extension. So this is how I actually have it set up, prepared before I even start. Okay guys, so typically how I start off is I wash my hands and I put my gloves on. This is extremely important. Okay, now I've seen some videos on YouTube where people are just like doing it off the bat. Listen, you don't want anything getting in that Picc Line. So this is what it looked like. Mine is covered, obviously. I have a sleeve on it, so I'm going to remove the sleeve very carefully. And I have 2 lines. Typically with this Picc Line, I go in every week for blood drawn to make sure on my liver, my kidneys, everything is right with this type of medication and all of that jazz, and they flush it. So let's see here, let me just, because I got it all like wrapped. Okay, so these are the lines. The Picc Line is right there. That's the incision part, and it goes right there, and it's going, the line is going all the way up through my chest right area, very close to my heart. So I have 2 lines, red and purple. The red one I don't use to do my medication, is just an extra line. I still have to flush it every day, but when I do go in to get my blood drawn, this is the line they use. But regardless, I still have to flush it every day. And the purple line is the line that I use to take my medicine. Okay, as I told you, I have my setup here. So what I'm going to do first, I'm just going to actually open all of these and get it set up, so when I start to push, I'm done. So with each vial, this is the heparin, and this is nothing but like a baby aspirin. It's to make sure that, you know, that blood and the catheter and all that stuff is thin. It's like it's a blood thinner. So with all the syringes, I'm going to unloosen the cap a little bit, because you want to take out all the air. You're going to push back a little bit, push up, and that's how you do it. And I'm going to do that for all the syringes. I'm going to go ahead and speed this part of the video up. Okay, so the first thing I'm going to do is take my red line, and I'm going to flush it out because it's just quicker. So I'm going to take this clamp, and I just need to unclamp it so the liquid in the syringes could go through. Now I am so OCD and just so sterile. Before I even release this cap, which is already has alcohol in it to keep it sterile, I am going to take a cloth, a wipe. Okay, I'm going to remove it first. I'm going to open it. Then I'm going to open the cap, discard it, take my alcohol wipe, and I'm going to swipe for 15 seconds. Okay, the reason why you want to do this is because you want to make sure that no bacteria, no dirt, nothing is getting in this thing to get into that bloodline. Because guys, this is a Picc Line. This goes directly into your vein, and you just have to be careful. You just have to be really careful. So what you do is then after that, I'm going to discard that, and I'm going to take my saline syringe, open it, attach, very carefully twist and push. You know, you push a moderate level. Here, I hope you guys can see what I'm doing. Moderate push there. I probably go too slow, to be honest with you, but this is saline. You can't overdose yourself on saline, so your body is made up of all water. So before I even take this syringe off, I'm taking my alcohol wipe. I'm going to open it again, a different one obviously, and then I'm going to remove this and then wipe again for 15 seconds. You have to do this in each interval. Every time you remove it, you're swiping for 15 seconds. You know, when I first did this process, guys, the first few times, I mean, just sitting here having to comprehend and process that I have to do this shit for 28 days. I mean, I've accepted it now, but now I'm gonna take the heparin. I'm gonna remove the cap in its entirety now. Go ahead and just push it on through. Now, this part, you don't have to, I don't have to clean it again because those green caps have alcohol already in it. But again, I'm anal and I ain't got no time to be getting no infection. So again, open the alcohol pad, remove the syringe, remove the alcohol pad, and wipe. I hope you guys see, you know, it's first time I'm doing a video like this. And now I'm going to take the green cap and open it. Again, this is already pre-filled with alcohol and all that stuff for whatever. And I'm going to twist it. And I'm done. Now, you always want to remember to get that clamp. You can put the clamp anywhere you want. I just prefer it to be down here because when I wrap it in my arm, and just push it and close it and seal it. A lot of times people forget to do this. You know, people are trying to give themselves their meds and they're like, it's not pushing through, is because they still didn't unlock the clamp. But when you finish, you want to lock it back up. Okay, so now the fun part, right? So now I'm going to take my purple line. This is where I'm going to do the administration of the meds. And this is going to be a little bit different. In terms of, you know, you still unclamp it. Okay. Now, with the Rocephin, I have to push that medication between 5 and 7 minutes. I can't just put the syringe on it and just like, boom, you know, push the med, because it could give me a reaction. I could like probably die, who knows, I don't know. You're just not supposed to just automatically push it in, you know. You could get just not allergic reaction, but definitely some serious side effects from it. So I have a stopwatch. Okay, I am on 2 milligrams of Rocephin, and I'll explain how I'm going to do it the first one, and then I'll speed up the video. But for right now, let's just go through the process. So again, before I even unclap this, I am opening up my alcohol pad. I'm going to remove my green tab, discard it, and wipe for 15 seconds. The first step in this line is again to flush it with the saline. Make sure the line is clear before you're able to administer your medication. And again, you can go pretty, you know, moderately fast with this. It's only saline. You can't OD on saline. Okay. So that's in. Now again, before I actually unscrew this, I'm going to take another alcohol, open it, discard, swipe. Now, I'm going to take my meds. This is the Rocephin. I'm going to open it up, carefully attach it. Okay, now again, this is 2 milligrams. Okay, so the 20 is right here. I'm going to do halfway interval, and then I'm going to put my timer on from my cell phone. I have my timer, see? And then when I push it halfway, I'm going to push the timer for 60 seconds. And then when that's done, I push again, 60 seconds, push again, because it has to be between 5 to 7 minutes. And going halfway is exactly, going halfway and then waiting the 60 seconds is exactly 7 minutes. So again, here is, hopefully my name is not showing in my address. So here we go. I'm going to push, and you push slowly, okay? I'm gonna go up to, like, you know, midway, half point. Now I'm gonna start my watch, and I'm gonna wait 60 seconds before I push again. So again, guys, I mean, I'm going to not do this. I'm gonna speed up the video, but just while we're here, again, this whole process is a process. It's just been a real struggle. It's been a real struggle, and to make it so bad, I may not even have Lyme disease. This is, you know what I mean, but I'm being treated for it because I did show some markers for it. And that's the whole thing, is like, nobody knows what the hearing loss is from. The Lyme disease may be Lyme disease or not Lyme disease, but I need to be treated for it anyway, just in case. I mean, it's like, I feel like I'm a science experiment. And it's just been really, really bad. I mean, the ringing in the ear, you have to take something at night to sleep, you know, because that ringing will not let you sleep, you know. It's just been real difficult. So the timer went off, so I stop it, dismiss it rather, push again, to the halfway point of that, and then start the timer again. I'm gonna go ahead and speed up the rest of the process, and then we'll chat when I'm done. Okay, I am now done with my Rocephin. So again, before I detach from the line, I'm gonna open another swab. Now, so redundant. My timer is going off, and I'm gonna swipe for 15 seconds again. Again, guys, this process takes about, from start to finish, about 25 to 30 minutes. I mean, obviously I've gotten quicker at it, but it's just a process that you don't want to have to do every single day at a specific time for 28 days. Okay, so now I have to do another saline to flush that medication through, make sure it's getting all up into the vein and all of that good jazz. So I'm gonna go ahead and flush the line and make sure that medicine is being pushed all the way through the catheter and into my bloodstream. Once again, this is the last step. I'm going to detach the saline. Again, swipe. And you know, about 15 seconds, you know, but I typically do it for 15 seconds. Half my backdrop is not covering my wall, but you guys understand. This isn't a makeup video. I wish it was. Okay, now I'm gonna take the last heparin. Again, it's a blood thinner. And this is the last thing that you want to do for both lines. You start with saline and you always end with the heparin. Okay. So I'm gonna, before I detach, one more time with the swab. I won't do it for 15 seconds though, because the green cap again has already pre-alcohol in it to make sure that this line is gonna remain and stay clean. Okay, now I take this off, attach it, close it up. Hello, don't give me a hard time. There we go. And again, you do not want to forget to close the line. Okay, now you guys don't have to do this, but again, I'm anal. I usually just take a swab again, and I might take it and I kind of run it through over the line just to clean it, you know, the outside of the line. Take another one and do the red one. And you don't have to do this, I'm just extra. So clean it. And then also what I do is I like to clean the outer area of my skin before I wrap myself back up. So, you know, there's my arm, and I just like to, you know, just wipe it off, you know, the surrounding skin. And just, you know, just cautious, you know, all that fat. So again, I just want to make sure that you guys see what this Picc line looks like. My 2 lines, okay. And there is this actual where it's punctured into my skin and going all up into my vein. So now what I do, you can take your gloves off at this point now. And I have a sleeve to, you know, keep it all secured. And these are the good ones too. They got cheaper ones too. They're not good. So you open this up. And I'm gonna stretch it. Okay. So what I'm gonna do is I'm gonna take my, this is how I wrap mine up. Some people just wrap it all up like this, but I actually wrap my line around my arm, and then I tuck these 2 underneath. So to secure it, okay? Just like such. Okay, just wrap it around the arm. And you take your sleeve and you just cover it up. Because of course, you know, I'm not trying to go to work with this showing, okay? I've been wearing cardigans and stuff like that. Because obviously you see my dress, this is the type of stuff I wear to work, but I wear a cardigan over it. And it's hot too. Summertime. But I ain't trying to let everybody be up in my business. So that's the good thing, that these can be very discreet. You know, you could go to work. The Picc line does not at all hinder your ability to go to work or anything like that. It just, what it does do is that you just can't like pick up anything over 5 pounds with this arm. I know, right? 5 pounds. So then I just secure it. I mean, I make sure that this part is not too tight. You know, that's why you want to stretch it before you put it on. And basically that's it. This is what it looks like afterwards. This is the cover. It's very secure and nobody will see it. You wear a cardigan, nobody sees it. Or I mean, even if you put a t-shirt on, you really can't see it. Especially if you put this up just a little bit more. A t-shirt will actually even cover this, depending on the t-shirt, you know. So that is the whole process of administering my Rocephin through this IV. So before I close out this video, I just want to again just kind of reiterate and let you guys know that this is a very difficult thing to go through. If you have a sudden sensory neural hearing loss, please just obviously go to the doctor right away. If you start hearing the ringing in your ear, make sure you go to the doctor right away and do your research. You are your best advocate for your body, because to be honest with you guys, if I didn't tell my doctor to test me for the Meniere's and the Lyme, I would have never known that I had markers for Lyme disease, which can make my condition a lot worse if I really do have it. So you have to trust your gut. Do your research. I mean, doctors are doctors. They can't help themselves. They just want to put you through treatment, want to do things to you. I know, I'm in healthcare, so you have to be your own advocate. This hearing loss is just been so devastating to me. Sorry, I'm not gonna cry. I'm not. Stop it. It's just been so hard for me, and then just to go through the process of everything, the day to day, the every week going to the doctor's office, being pricked, having surgery, not knowing the cause of my hearing loss, having to do a Picc line for heaven's sake, and be on a medication for 28 days when you're injecting yourself, you know, and to even know that you may or may not have Lyme disease. You know, it's just, everything is just so screwed up right now, and I'm just being totally honest with you. It's just been a real struggle. My hearing loss has not returned, but the lightheadedness is getting better. I still feel very heavy on this side. I'm tired. You know, I mean, obviously I'm on medication right now. What I'm going to do is, the Picc Line comes out next week, and I'm gonna do another video to give you an update on how I've been, if I'm even testing for the markers of Lyme disease and all of that jazz. I'm gonna, you know, just add to this video in a few weeks. But most importantly, I also want to thank all my friends and family that have been there for me. I am so blessed. I can't even like begin to show my appreciation and gratitude to those who actually stuck this out with me, like day in and day out, who stood with me when I got out of the ER for 6 days, made sure that somebody was here with me so I don't fall, because I was so dizzy I could barely walk for that time. And I just can't explain it, you know. And it's funny, like those people, like, you know, man, you know, those people who love you, that come through for you like that, you know. And that's it. I mean, I can't, I'm stuttering because I don't know what to say. Words will never ever be enough to show or to express my gratitude, my appreciation, my love for these people who are loyal to me and love me and help me through this. I mean, you guys have no idea, and I'm just so grateful. I don't know what to say, but again, I just hope that this video helps somebody out there. I hope if there are individuals with hearing loss experiencing Lyme disease and true Lyme disease, you know, where because there are people with Lyme disease that have symptoms that I mean, like they can't even walk. I mean, but again, I don't know if I really have it. But the point is, maybe this video could help somebody that has Lyme disease and could understand the treatment of Lyme disease and what I had to go through. Now, all the treatment of Lyme disease is not this aggressive. I had to have a Picc Line because they're associating it with late Lyme disease. If I did have it, I've had it for a while. And plus, because I have the hearing loss, it's basically a central nervous system issue, so they want to treat me aggressively. So I get it. Not if you get it, if the doctor detect Lyme disease early, you'll get some antibiotics for 28 days instead of what I had to do. But the point is, just know that you're going to get through it. You know, rely on your friends and family that are going to be there to support you. It is hard. Hearing loss, this Lyme disease issue, the Picc Line, the anxiety, depression that comes along with it, because you can't sleep, because you can't do nothing, because you're weak, because just it's like your life just halts. It's just, you can't hear. I mean, hell, one day I can't freaking hear in my left, and the fear sometimes I have of that happening into the right, it's just unbearable to think about sometimes. But in closing, I hope this helps somebody out there. I hope my story helps. I appreciate you guys tuning in. I appreciate all the love and support that I have from my friends and family. And I also appreciate my subscribers that even clicked on this video to look at it. If you know anybody that has experienced anything I have experienced, please share my video. Share it on your Facebook. Share it on your Twitter. Talk about it on your Instagram. Direct them to this video, whatever you have to do, because people just need to know that they're not alone when it comes to this. Thank you again so much for tuning in, and I'll see you on my next video. Bye.